Good afternoon, everyone. You're welcome to Anglican Liturgy today, where we talk about the issues that create challenge for us as Anglicans and the way to ensure that we continue to practice our faith, shine the light of Christ in a very challenging world. Today we are going to be talking about the issue of the day, which is the coronavirus. And we have one of our experts in the diocese, actually the director of our medical directorate, in the person of Reverend Dr. Oluwawemimo Oluwafisayo Adebiyi, who will share with us the things that we need to know in terms of our common worship. But before we start, we'd like for you, Reverend Doctor, to introduce yourself to our viewers.
Well, thank you for the opportunity to be a part of this discussion. As introduced, I'm a physician by training, but also an ordained priest within the Anglican Church. I pastor one of our churches here in Indianapolis, Evangelical Church of the Trinity. And by the grace of God and by the permission of our bishop, the one coordinating the health directorate for the diocese. And that's, I believe, the reason why I'm here to provide guidance and more information regarding the issue of the coronavirus that is affecting different parts of the world and also different parts of the United States especially.
The medical directorate, can you give us a little more information about this units of our diocese?
Well, the medical directorate, or what we call the health directorate of Anglican Diocese of Trinity, to me has three main focus. The first of them is education of our members of our churches and other fellow Christians with regard to overall health needs, health challenges, or things that pertains to health. So we provide education through seminars when necessary. We provide leaflets, we educate the public, we educate in the church. We especially want our people not to fall a victim of things that they can potentially avoid. So that's the first thing that we try to focus on. The second thing is intervention when necessary. So some of our churches have clinics or free clinics whereby people, especially who don't have insurance or they are underinsured or don't have access to necessary medical services available in different parts of the country, where they can come in and get some basic intervention as may be needed. And also not only intervention in that sense, if anybody has medical conditions that they really want somebody who shares their faith to discuss with, to discuss their diagnosis and just to get a guidance without compromising their spiritual principle, or at least to be led right. The health directorate is available in such circumstance to provide such a guidance. And thirdly, which is what we hope is the future of the directorate, we are trusting God. It could be in 5, it could be in 10 years, that maybe the diocese could grow enough to a place of owning its own clinic, its own hospital as the Lord enables, so that we can provide care directly to our patients without any fear of us doing anything wrong. We want to do things that are in keeping with the Christian principle, in keeping with our belief. So these are the three main focus of the health directorate of the diocese.
All right. So to piggyback on, or rather circle around to exactly why we have you here today, this afternoon. We hear a lot of information, a lot of anxieties, lots of concerns about this coronavirus or COVID-19, all kinds of names that people are calling them. Can you tell us what this hysteria is all about?
Well, to start with, the coronavirus is not something new. So it's not something entirely new. The coronavirus is a large group of viruses that are found in humans, but most often in animals. In fact, I would not want to bug you with the details of all the medical jargons regarding this, but it's often described as an enveloped virus, positive sense with a single-stranded RNA. What this simply means, any virus that is described as a positive sense RNA virus has the capacity to infect a host cell and cause that host cell to replicate itself. That's what that means. That means it doesn't need, it just takes over your body and makes your body reproduce itself. And that's the way it's able to continue to regenerate and spread. And this coronavirus, most of the time, like I said, was initially found mostly in animals, camels, rats, cats, bats. For instance, when the coronavirus, the current COVID-19, so to say, was first found, it was supposedly found around where there is exposure to a lot of animals in China, in the Hubei province there. So it was because it's actually described as what we call zoonotics. That means an infection that is transferred from an animal to human being. That's the definition of zoonotics. But at this point, because it has that intricate ability to make the individual replicate itself once it infects, then it begins to spread from one person to another. And like I said, this is not the first time we are talking about coronavirus. In fact, in the medical literature, about at least 7 strains of coronavirus have been identified in the past. The ones that most often has been known is the SARS virus, or the severe acute respiratory syndrome, that was described in the early 2000s, that was initially common in Asian countries. And later, around 2012, we have the Middle East Asian respiratory virus, what we call the MERS virus. All these are coronaviruses that has this predilection to cause a lot of respiratory infection, severe respiratory infection. And the current coronavirus, which has been named COVID-19 or SARS-CoV-19, is similar in the sense that it started from animals. Presumably, it's actually been documented that the particular strain of the virus that was found in the US here is similar to those ones that were found in Italy, and they've been traced to bats. So initially started as zoonotics, but once it spreads beyond the animal, it could go from one person to another and just keeps going from there.
Okay. As a clergyman, we have a congregation that we pastor. Yeah. What are the symptoms that we should be looking for if we are suspecting that one of our members may have this virus?
Well, the unfortunate thing about this particular virus is that the symptoms it presents with is very, very similar to what we call the common flu. Okay. So the symptoms, in fact, a lot of people will not have any symptoms. And that's the reason why they can spread the infection even when they don't think they are sick. Oh. So it takes, at least is from what has been reported, it takes about 5 days to 14 days before anyone develop any symptoms after they've been infected. And the symptoms will go from nothing, that means you don't have anything, or very mild symptoms. Mild symptoms meaning just feeling fatigue, cold, some snuffles here and there. But if we have to start thinking about suspicion, this is where history becomes important. So the first reason to suspect anyone is obviously if they have evidence of respiratory infection. So you have somebody with fever, somebody with cough, somebody with upper respiratory infection, sore throat, maybe diagnosed with pneumonia in the hospital. Those are the areas that we start to suspect infection. But much more, what we take that deeper, oftentimes will depend on medical evaluation. So when your symptoms cannot be explained by reasonable medical findings, that's where that heightens, especially if you have potential history of contact with anyone. So one of the things that we say is that if you have this kind of respiratory symptoms, cough, fever, or similar symptoms, and you've been out of the country for the last 21 days, or you've visited the endemic area, so you've visited Iran, you've been to China, you've been to Italy, you've been to France, you've been to many of these places, South Korea, with severe infection, then we really want to take it serious that potentially you might be manifesting the symptoms for COVID-19. The other thing, in other parts of the US, for instance, we know we have a lot of reports around Washington area, around Connecticut, and some other Texas. So if you visited any of those areas and you've come into close proximity, remember that this is what we call a droplet infection. That means you don't necessarily have to touch the person one-on-one to be infected. You just need to be within the same environment. And some have suggested at least once you are within 6 feet proximity to the individual, you have a potential of picking up that infection from them if they are a carrier in the first place. So I think it's going to be, if you want to suspect anyone, it starts with the symptoms, okay, and then with potential history of where you have been in the last couple of weeks, okay, and that will raise or heighten the suspicion for such a virus.
How can we help our members to allay these fears so they are not, we are not in necessary, they say it's pandemic, which means it can become pandemonium if we allow it. So what do we need to do to make sure that our members are calm and we are approaching this?
Well, I will speak to that in two ways. Okay. I will speak to it in the medical sense to start with. We have to understand that at least so far in the US, for those who live in the US, I'm not too sure. We can begin to use the word pandemic, but by definition, we are almost there, especially within certain communities. When we use the word pandemic, we're talking about an infection that has the potential to spread from one person to another person, defiling every form of containment and causing death. That's by definition what a pandemic is.
So we're not there yet.
So maybe in certain communities like, say, Washington or Seattle areas, wherever you had this disease that is just spreading widely and is causing a lot of death, we may begin to apply pandemic terminology to such areas. But in most parts of the country, I'm not too sure we've reached there. So places like China, France, South Korea could probably use the word pandemic because of how rapidly it is spreading. But should we then say that it does not have the capacity to become pandemic in US? We will be wrong. Because if it's done this in other countries, that means there is a potential for that to happen. So should we be afraid? I don't want to use the word fearful, but we need to be cautious. Cautious in the sense that you know what is going on around you. The good thing about the country right now, especially through the public health system, through the Center for Disease, the country and every part of our neighborhood is constantly being updated with information. Is for you to be aware of what is going on in your community, what is going on in your state. I would say that if your state has never reported any episode of coronavirus, or even if it's been reported in your state and it's not where you live, probably we don't need to go into that panic mode. to do things. Now, that doesn't stop us from taking the necessary precaution, but at least we don't have to live in the fear of us being able to do our daily things. The other thing is, depending on what you do. So, who are the people that maybe needs to be a little more fearful or more cautious? If you live in any area, or if your job responsibility exposes you to more people than usual. So you are talking about those who work in the airport, those who work in the restaurants, those who are in the football stations, hospitals, health workers. For those people, those who organize big conferences that people come from all over the world, people go for big concerts and you organize those things. If you work within such a setting, then you may want to reevaluate how you approach things, because even though you don't know any one of them that is sick, but there is a potential that you may come in contact with them. And that's speaking to the medical aspect of it. With the spiritual aspect, at the end of the day, our life is in God's hand. Our life is in God's hand. God doesn't want us to be walking around with fear. We pray, we trust God for wisdom, we apply the wisdom God gives to us. And if you wake up one morning and God is telling you, we are spiritual people, we pray. And God is saying, look, maybe where you want to go by the Holy Spirit is inspiring you. Maybe you should not go there today. Maybe that person you want to visit, maybe today is not the best time to visit it. That restaurant is not today that you should eat there. By the spiritual sensing that we have as Christians, maybe God guiding us, we may be able to avoid a lot of evils that are out there.
So, going back to our local congregation, what are those precautions? You talked about precautions.
Yeah.
What are those types of precautions, the practical things that we should be doing?
Well, I will say at the level of the congregation, this is where we have to be our brother's keeper. We need to know ourselves. The pastors, the priests, the leadership of the church needs to know their members. You need to know what is going on with one person compared to another. I know some of our members maybe don't want to be bothered, but where this becomes important about this time is, let's all be conscious of how everybody is doing. So, as a pastor, I want to know if my brethren are having any sickness, if they are exhibiting any symptoms. And once we all become aware, we watch out for one another. So even as a priest, if I know I'm nursing a respiratory illness, I'm coughing, sneezing, I'm having very high-grade fever to the extent that I feel like I need to go to the hospital, maybe it's a day for me to take off from church and let somebody do the service that day and not expose any other person. If you know that you are sick, or your children is sick, or you have come in contact with anyone that is sick in this sense of respiratory symptoms, I think it is appropriate that you stay away from service, not only for the sake of yourself, but also to protect your brethren. And this is all principle of what we call self-quarantine. For instance, if you think you have been exposed to a co-worker, or you have somebody who just came back from Italy or from Iran that you've been a friend with, or that you work together with, and now suddenly he got sick, you got sick, then maybe you may want to stay away for a few days. And then the typical prevention for cold, which is still the old way: wash your hand, cover your sneeze, minimize exposure of others to your respiratory discharges. Use your hand sanitizers, and just stay home if you are sick. Now, as a church, what do we do at the level of the congregation? There are congregations that are very big. One thing I've recommended to folks will be, if you have a very big congregation, this is why we have to go back sometimes to our apostolic days. This is where home fellowship becomes much more useful. Sometimes we may have to divide congregation into smaller units, especially if you live in endemic area. We're not talking about those areas where you only have one coronavirus reported or two or something like that. But when you have tens, hundreds reported, maybe for such a big church, with maybe 3, 4, 5 people already having this kind of symptoms, they may want to choose that maybe the next service should be home fellowship. Divide the people into home fellowship, whereby people that have no symptoms meet together, rather than bring the entire congregation together and we just spread the infection among one another. Those are the things I think we can do at the level of the church to really prevent the spread of this infection among one another.
All right. So we want you to put your prophetic cap on at this time. How much trouble are we as a country?
The truth is that this is a very bad disease. It's a bad illness. It's bad in the sense that, remember the flu virus, a lot of us, at least a good portion of people, are immunized against it. But COVID-19 is a new infection with very, very low immunity out there. So it's potentially fatal. I know at least in China they reported a very high fatality among those people that have been exposed or that have developed the symptoms compared to the typical flu. Especially those who have what we call comorbid conditions. So people who have had chronic heart problem, chronic lung disease, diabetes, chronic kidney, they have cancer, or people who are taking special chemotherapy, immunosuppression. Their ability to fight this infection is much more difficult. So we're trusting God to really deliver us. This is a big deal. This is a big problem, simply because we don't have what we call the herd immunity. Not many people are immune against this. And the days of vaccination, even though they've been talking about it, but it takes months or probably 1 to 2 years before we can develop successful vaccination. So even if we develop vaccination, I'm not too sure it will save us this year. I'm not too sure, and that's just my guess. So this is a big problem that should not be ignored. And some thoughts even in the medical field are of the opinion that we may never be able to get rid of this. That is something that maybe, if we're able to control it, we may have to figure out a way to live with it with respect to treatment. Currently, there is no treatment. It's all supportive. But maybe some medications will come up in the future to treat it. And the reason for that is simple. Just because of the way in which it's spreading. So what will likely happen eventually, let's say we're able to contain it somewhat, what of all those people that never had symptoms and they have the infection? Who knows what that can do in 6 months, in a year? Somebody who never had infection today that came across another person that potentially is vulnerable will just spread it again, and this whole cycle begins. So I think we're in this for a long time. That's the truth. And we just have to figure out a way to manage it so that at least over 3,000 people in the world are dead now. So that hopefully we can contain it and limit the fatality associated with it.
Lastly, we have some situation that is particular to us as immigrants. Some of us may not have our papers. Some of us may not have insurance. What would be your recommendation regarding these specific situations?
Well, I would say this is where your health is priority. I know that access to health field, access to the hospital is key in dealing with this kind of illness. But I want to plead with our brethren, no matter what you are thinking, no matter what you may have in mind, no matter your fear, your life is much more important than those fears. So if you think you've been exposed to anything like this, especially you are having that cough, that bad fever, that bad respiratory illness, you can't breathe and you are not feeling good at all, please seek medical help. let's keep you alive first before we worry about the other issues that you may be thinking about. At least the good thing about most part of this country is that, I mean, you will be taken care of, and then we'll begin to figure out where we go from there. So don't sit at home. Now, if the symptoms is not terrible and you think you are doing fine, maybe you should. But other than that, if you are really feeling sick, don't let anything, no matter what that is it finance, is it immigration status, is it the fear of arrest, is it anything? Because not only are you not helping yourself, you are not helping the world. Because if you are sick, let's say you even have the coronavirus, the longer you stay at home and you are exposed to people, you infect more people and you cause more damage to the entire country. So if anything is going up and you think it's bad enough, please seek medical help. I think that would be very, very important.
Thank you, Reverend Doctor. Your expertise, of course, is very needed at this time. We know what you do for the Medical Directorate, for our sister church here in town, the Evangelical Church of the Trinity. We're grateful that you've been able to honor our invitation for this public service presentation. There you have it, folks. If you think or suspect that you're sick, especially if it relates to respiratory, coughing, those types of illness, please seek medical attention. It does not matter what else is going on with you. Your health is key at this time. It's a dangerous disease. As you've heard, it can kill. Our prayer is that none of us will become victim of this disease. God bless you all, and see you next time.
Thank you.